It's the largest drugless, non-surgical health profession in the world, but few understand its benefits and research. Some straight answers are up next on this week's Inside Out. Hello, and welcome to Inside Out. You know, this week the talk is on about health and what you can do about it. We're also going to talk about young and old people, the problems of muscle tension, stress, lifestyle, attitude, and goal setting. They're all important issues. Well, my guest has some advice on all of them, so we're going to tap his brain and find out a little bit more about all of them. He is Dr. Robert Sheely. He's past president of the Ohio State Chiropractic Association. He has his own practice in Trenton, Ohio, where he's also president of the Chamber of Commerce, of course. We welcome you to the program.
Thank you.
We'll be ready to begin our discussion right after this word. Welcome now as we begin our discussion with Dr. Robert Sheely, a chiropractic physician. Much has been said about chiropractic and exactly what it involves, and I think there's people that have looked at it with disdain, or other people that say, yes, it's the greatest thing. It's something that people should definitely go toward. Give me an idea of exactly what it is you do in terms of the kind of work that a chiropractic physician would handle.
Well, a chiropractor basically works primarily with the neuromusculoskeletal part of the body, dealing with nerves, muscles, and bones. We have a tremendous number of people that come in with low back problems, headache problems, shoulder and knee joint problems. And we specifically try to look at the structural problems and to see what's causing the pain. We do not give medication. If a person needs that, we'll make a referral. But so many times we find out that if we can find out what the cause of the problem is, we can correct it.
It seems that a lot of people have a problem with their back. I don't know whether it's just the aging process or whether it's something that we just do incorrectly in terms of the way we handle ourselves physically. If there was any one or two things that you could point out, what seem to be the most common problems that you see in your practice?
Well, a lot of times people get into poor habits in the way they sit, poor habits in the way they sleep. For instance, if I can call my friend up over here, you're supposed to have three curves in the spine, the lumbar curve, the thoracic, and then the cervical curve. And too many times when a person sleeps, they'll put their spine in an incorrect position, such as too big a pillow or too small of a pillow. And when that happens, you can get irritation of the nerve roots from, I'm going to put your little finger right in there, and how that can pinch and irritate. This is what can happen with our poor habits, and sometimes even accidents and things can cause pinching or irritation of the nerves.
Well, what can we do about it? I mean, how do you know whether the pillow you have is too big or too small, or the chair you're using at work or wherever you happen to be is a proper chair? I mean, do we have to have a stiff, solid, upright chair? I mean, what would be your...
Well, the best thing to do is to make sure that you have a proper curve in the spine. When you sit in a slouch position, that pulls this curve out, and that puts a lot of pressure on the discs, and the discs then can irritate the nerves. It just makes good common sense to use proper sleeping habits. For instance, there's a normal curve we talked about here. If you have a pillow that promotes that curve, that'll help. And since we do sleep a third of our life, it makes a big difference.
Okay, I come in and geez, my back is just really bothering me. I'm having trouble getting up from a chair and whatever. When is it time for me to see someone like you or to seek medical help? And when should I just take a couple of aspirin and try to just tough it out?
Well, if it's something that continues and more than just a couple of days, it makes sense to at least check and to make sure. If you've never had a problem before and you get severe pain, there's always a cause for it. It may be a simple strain, but many times people know that if they've slipped or done something like that. But nerves can be irritated, and it makes sense to check it out and make sure first.
Now, a lot of people are fearful of surgery, if there's a slipped disc maybe, or concerned that way, and they just shy away from a doctor because they don't want the bad news, I guess. Now, you don't involve yourself with surgery.
That's correct.
So would you be the first line of defense in terms of a concern about a back problem?
Well, today so many people are concerned about that. In fact, if they can get well without surgery or drugs, that's what they want to try to do. The chiropractor specializes in conservative care. If it's a mechanical problem, and many of the back problems that we see are mechanical type problems, it makes sense first to see a chiropractor because we can help manipulate the joint so that it moves back where it should be to take pressure off the nerves and also balance muscle structure too.
Talk to me a little bit about the image of the chiropractor in terms of, I know the medical profession has been back and forth in terms of whether or not they really endorse the kind of work that you do, and others have looked at that, I think, and thought, well, gosh, maybe there's something unscrupulous or something that is a quackery nature, if you will. Straighten that out for me.
Well, I'll tell you, there's been a tremendous amount of research really in the past, really 20 years that have shown the great benefits of chiropractic care. There was an antitrust lawsuit that was against the American Medical Association and showed that they violated antitrust laws in trying to tell people things that weren't true. The truth is the medical doctors were victim of the American Medical Association telling them things that weren't true, and that's all come out in the lawsuit. But we really today choose to go forward from that and rely on the research that's there that shows that we are in fact very cost-effective and safe, and a lot of studies are showing that now.
What do the insurance companies say in terms of backing you up and the kind of work that you do? Are they more supportive today?
Well, I was just recently in a meeting here of a very large HMO here in the Cincinnati area just a couple of weeks ago, and the director of that indicated and quoted some of the research that shows that chiropractic care is in fact more appropriate for much of the back problems that present themselves in many offices today. So again, the research is showing, coming forth first and showing, and a lot of the insurance companies are understanding that. Chiropractic care is covered by most insurance companies now anyway.
In terms of back problems, are they generally speaking hereditary, or are they things that we cause ourselves simply because of poor sitting habits and so forth?
Well, some of it is hereditary, but interestingly, 8 out of 10 people will have a back problem at some time in their life. So that sounds like a lot, but you talk about a person's hereditary in their family, they say, oh gosh, my uncle and my brother and everybody had problems. Well, the truth is, after a period of time, everyone will experience at least some acute episode of back problem.
Stress is a problem for all of us. To what extent does it contribute to back problems?
Stress is a key word today. It is a big problem in that it is really the way we handle stress. Sometimes we decide to internalize it and make it a big problem, and it can cause muscles to tighten up and cause us to be in habits and in jobs where there's a lot of stress. It can cause extra tightness of muscles, which then can in turn interfere with the nervous system.
What would be your recommendation on how to handle it and how to deal with stress then, and in terms of just your own physical ability to adapt to stress and continue to do your work?
Well, I think one of the biggest things that I recommend my patients to do is to look at their lives and get their lives in balance. Many times we set our priorities wrong. We spend all our life at our work, or maybe some of it all at home, which that doesn't happen too much today. But I really feel that priorities should be God first, family second, and then business last. And I think when you do that, things tend to line up in a lot better system, and there is a balance that seems to happen with that.
We need to take a time out. When we come back, much of our conversation here has been looked at, and I think some viewers might say, well, this is for people who are getting on in years or beginning to have problems and so forth physically. But you have a very strong message to young people as well, and I'd like to get into that and tap into that when we continue. So don't go away. We'll be back right after this one. Welcome back. We're continuing our conversation with Dr. Robert Sheely. And really, much of what we talked about is back injuries and problems associated with the back, and you do a lot of work with the youth of this area in terms of going out and talking motivationally and spiritually and otherwise. There are concerns, I know, about today's youth and it being tougher to raise children today, and then they have a lot more that concerns them than perhaps we did when we grew up. What would you say is the primary message you give to young people today in terms of just how to conduct their lives and in a helpful way and develop a good attitude about living? Well,
I guess the first thing I would tell them is that they do need to realize they have a gift of choice. And I believe it's a God-given gift of choice, that in any situation they can choose which direction to go. For instance, if a person is tempted with drugs, their peer, their friend, is trying to offer them something great, they can choose. I believe also parents need to realize that they have tremendous influence over their children. Too many times parents will say things like, don't do that, just plain don't do that. I try to suggest ways to talk with them, to say things like, that's not like you. To say to their children, that's not like you to do that. You're better than that, or you have better judgment than that. Or when something goes wrong with your child and they do things that you don't think they should, or they do things they should do, you say, that's like you, and encourage them, always in a positive way. The way we talk is extremely important, and the words that we say are extremely important.
It's tough out there being a parent today, particularly in many households where you have both parents working. The time that you spend with children is very minimal and is precious in a lot of ways and for a lot of reasons. How would you, or what would you suggest to a parent in terms of disciplining children today, given the fact that mom and dad they're not home as often, and oftentimes the children are home before they are, and a lot of their own time is spent by themselves?
I think probably some of the best advice is as I was talking before, to encourage them. When you catch your child doing something right, get crazy about it, get excited about it, and say, I have a little son, Kyle, he's 6.5 years old, and when he does something right, I just really get excited about it and say, that's like you, that's just the way you are. And like last night, we were sitting on the bed before he's going to sleep, and had the name Kyle, and so Kyle is wonderful, terrific, fantastic. And of course, I read those to him, and I said, you want me to read them again? He goes, oh yeah. We all like to hear good things about ourselves.
From a health perspective, what do young people need to know in terms of taking care of themselves today? We hear all the caution and the red flags about different diseases and so forth, but in terms of your profession, what would be your advice to young people today and how they handle themselves?
Well, in chiropractic care, we deal a lot with prevention. We try to talk about habits and things that people can get into that will mold their life. Habits really create your life. If you have bad habits, you'll have a difficult and challenging life. Getting enough sleep, just some of the real basic things. The way you talk, if you kid with people and say, oh, you silly person, or you dummy, or something, that's going to come back at you. The words that you speak actually have a lot to do with what you do in creating your own life.
What about exercise? If somebody is beginning to have a soreness in their back or whatever, obviously you would not exercise perhaps for that moment, but a certain amount of stiffness or soreness goes along with exercise in some cases. How do you differentiate one from another?
Well, we tell patients that if there is pain in exercise, if there's real pain in exercise, then there's something wrong. Everybody has gone out and rode 10 miles on a bicycle at one point, and there's a soreness, but that's that it feels so good type of thing. You've really done some good work. But in exercise, if it hurts, for instance, if a person has a back problem and they do their normal stretching that they've been told to do, and it hurts, that's a problem. That's something that needs to be checked out to see what the cause of it is.
Arthritis is a real concern of a lot of people. Are back problems associated with arthritis often?
Arthritis, arth means joint, itis means inflammation of. So when you put it together, arthritis is any joint that hurts. Interestingly, if I would hit my thumb with a hammer, it would be arthritis. So there's really about 100 different causes of arthritis. Now, some of it is degenerative arthritis. Some of it is a time process that seems to come in after a period of time, but only after there's been some irritation to the joint. And the whole idea is to prevent irritation with proper exercise, diet, rest, the whole basic things that sound so boring but are so true.
Can someone who is having problems along those lines, that is to say that they have been diagnosed as having arthritis, come to you for help?
Hugh, I've had so many people that have come to me and said, well, I'm not sure you can do anything because I have arthritis. And like it's a secret disease that crawls in the middle of the night. The truth is, a joint that's irritated, as I said, can be diagnosed as arthritis because it's a general term. And so many times people that have arthritis are helped tremendously with chiropractic care.
Give me an idea, a profile of what happens if I come into your office and I'm complaining about some kind of a back problem and so forth. What typically do you do? How does that come down?
Okay. Well, we will first do a thorough consultation and sit down for several minutes and find out a lot of the history. We don't just check the main complaint. We do a whole history, checking all the different systems of the bodies, because everything is related. We'll find out what the problem is and the chief complaint, and then we'll do a physical exam, checking vitals, range of motions, orthopedic neurological checks. This isn't something that I do. All chiropractors do this. Right. And then if necessary, we'll do x-rays to determine more specifically what the problem is. By diagnosing and finding an exact cause of the problem, we find out if we think we can help or not. If we think we can help, we'll tell the patient. If not, we'll make a proper referral or other diagnostic tests.
For young people, there are pediatricians and so forth. What would be your recommendation? To go to a pediatrician first, or to see you on a regular basis just to get a check and make sure that everything is functioning properly?
Well, I think this is general advice for a lot of people. Now, many people are understanding that they need to take, as I mentioned before, the gift of choice. They can choose by reading and understanding that they can take an active part in their health care. In chiropractic care, we work together with the patient, talking to them about exercise. I have a lot of young people we do for scoliosis screening. A pediatrician also can do that. We work with the musculature instead of taking an x-ray and waiting for 6 months to see if it's gotten worse. There are things that we can do exercise-wise and manipulation or adjustment-wise to the spine that can help correct the problem in the process.
In terms of getting on with your own life, I know setting goals is an important thing. That is an area that you stress in a lot of your talks. You have a very varied life yourself in terms of the things that you involve yourself in, as we talked about at the beginning of the program. Talk to me a little bit about the stressing of goals in a person's life.
Goals are so vitally important, I believe, because if you don't have goals in your life, you'll never know if you've reached anything that you set. I mean, you'll never know if you've gotten where you want to go unless you've set some goals. It's very important to have goals. They add excitement and enthusiasm to life. If you reach a goal, you can be excited about it. And if you don't have any goals, you'll just oh-hum, same old, same old. Well, you need to set goals so that you can feel like you've accomplished something. I have goals set for several years in advance, and it makes things exciting all the time.
We need to take a time out. We'll pick up our conversation again here in just a minute. Don't go away. Welcome back now. We pick up our conversation with Dr. Robert Schuley. And, much of what you do involves going out and talking to the public, and particularly young people. How are you received? I mean, there are some people that might look and say, well, this is a nice, moral kind of an issue, or, you're just, it's nice talk. But in terms of the young people, how do they grasp what you're saying, and what do you tell them when you go out?
Well, when I talk to young people, for instance, I've talked to seventh graders for the past 6 or 7 years, and that age is such a transitional age. People begin to realize who they are and start to set goals. And it's exciting to talk to that age group because they do receive talking about goals and attitudes very well. People wonder why a chiropractor gets into talking about goals, and it has a lot to do with what I've understood in my practice and helping people to get well. There's a teamwork, partnership type of thing, and we work with them in setting habits and making goals that they would change their habits so that can change their life, keep them from getting the same problem that they came in with.
How do you set up these talks? Do you go in with a particular subject, or do people come to you? How do people make the contact in order to have you come and speak, let's say?
Well, fortunately, at this point, I've been in practice for 13 years, and a lot of people are calling me or calling my office so that we can set up some talks. And I like to do that because it keeps me hopefully sharp to know what's going on so that I can keep up on things. And it's exciting to be able to do that.
We've got a phone number that if you are interested in having Dr. Schuley speak or you'd like to find out some more information in terms of what we've discussed during the course of this program, the number is 988-9735. 988-9735. We'll mention it again before we close out in case you didn't have a pen there available to write down the number. There's so much uncertainty about life today and really kind of getting your act together. What's your recommendation to people, young or old, in terms of how to bring things together to lead a more happy and successful life?
Well, I really think that people need to sit down and define what it is that they want. I mentioned before about getting your priorities together. My own personal belief is that it takes a strong faith in God to trust God for things rather than to, so much of it depends, there's so much talk about the I, the self. And I think we need to realize where we came from and what we were created to do. And once you realize that, things tend to fall in order. Like I said, God, family, and then business or work, and everything balances out. And it's a key balance. It's getting habits in balance. And everyone knows what they should do, and it doesn't happen until you actually write it down. That's one of the first steps. You got to write it down for it to become real.
We all look for opportunities in life, and they're certainly they're making major changes every day in the kind of work you do and the research that goes into that field. What are some of the things that you see coming up in the frontier in terms of new innovations and perhaps advances in this kind of work?
Well, there's a lot of research, as I mentioned before, on spinal manipulation. 98% of the manipulation done in this country is done by chiropractic physicians. So it's a great time to be a chiropractic physician because we talked about research, the RAND study. The RAND Corporation has done just a vast study on manipulation and the benefits. The British Medical Journal a couple of years ago came out with comparing outpatient hospital care to chiropractic care for low back pain problems. Tremendous benefit and showing the benefits of chiropractic care in that. It's exciting because there's a lot of research to back up what we're talking about and why chiropractic physicians are getting so busy now, because people are coming to them.
Are you encouraged or dismayed by the funding that is available for research today and the course that our government seems to be taking in terms of, in many cases, cutbacks and a lot of that?
Well, if I was a person that got concerned about problems, I guess I would be, but I'm kind of an opportunity and a challenge person, and that just tells me that only the research funding that is appropriate and the best will get funded. So I believe that chiropractic research will continue to be funded because it's showing the best results as far as outcome studies. Outcomes are a word that you're going to hear a lot about here in research. People want to know what it is that really makes them feel better. And a lot of the research is showing that there's a great success rate with satisfaction of chiropractic patients.
Can you tell me anything about acupuncture and how that might factor into any of this picture?
Well, there is some research. I'm not as familiar with the research in the acupuncture, but there are trigger points that correspond with muscle trigger points along the spine that really have a lot to do with when we adjust the spine. There's different muscle trigger points that work along with that. I know there's been some special TV shows lately on acupuncture and the incredible things that can be done with that. But I'm truly more familiar with the chiropractic research.
Are we closer to the day when you, as a chiropractic physician, will be able to work hand in hand with your partners in the medical profession and perhaps even those in the acupuncture field? Or are you still at a point where pretty much you work in your own vacuum?
Well, Hugh, really that day is today, because in my practice I work all the time with medical doctors. We make cross referrals a lot. What the difference is, there's a perception that that's not true. And in the real world, there's a great working relationship. There's chiropractors on staff at the Jewish hospital here in Cincinnati. A lot of people don't know that. There's chiropractors on staff in over 200 hospitals in the United States. So that day is happening. It's just that people are starting to understand and learn the knowledge of the benefits of chiropractic care. And that's exciting.
And the safety of it all.
The safety, true. A lot of people have a perception that it's just not safe. Like, oh my gosh, they're going to get hurt. And that's just simply not true. In fact, there's more possibility of me falling over with a heart attack because of the exertion of giving the treatment than there is of somebody getting hurt from an adjustment.
Best way to pick a chiropractic physician?
Well, I think the best way is to call and do a consult yourself, to interview the doctor. A lot of the chiropractors today are tremendously well-trained and know exactly what they're doing, so you need to call or call your local association or state association.
Okay, with just a few seconds remaining, let me give the phone number again for Dr. Robert Sheely. If you would like him to perhaps come and speak to your group, the number is 988 988-9735. Again, that's 988-9735. Dr. Sheila, we appreciate you coming down.
Thank you so much.
Today.
I appreciate it. Had fun.
Thank you as well for joining us. We invite you to be with us again next time for another edition of Inside Out. Good day.